today I'm actually going to be doing plastic surgery. I'm actually going to be doing an eyelid revision and a nose revision. You will actually get to see how the surgery is done. So yeah, you guys are in for a journey. Hey guys, so this is the first night of my surgery. The time now is 1:30. Very happy to find out that my mom has written over here. There's porridge in the rice cooker. So I'm just trying to eat right now. This is how it looks like on the first day. Actually, it doesn't look as bad as I thought it's gonna be. I'm actually really pleased with how it turned out. You can see a lot more of the iris in here. Looking at the nose, I'm actually really happy because you can tell from the side that the columella is definitely protruding out a little bit more, and it is a bit more pointy, I would say. I wouldn't say I'm in pain, more like a little mild discomfort. My ear is, there's no pain to it, but it is a bit inconvenient because, oh sorry, got a bit of mucus. Oh my god, is that blood? How dramatic. But it's okay because Dr. Huang actually gave me some saline to flush the nose with. The ears are a bit uncomfortable because I can't sleep on my side anymore. I devised a plan which is to like have these two like small cushions there, one here and one here, two little bolsters. Then I just sleep on my side anyway. So I thought I'm very smart. So I'll continue this vlogging tomorrow. Love you guys. Hi, good morning guys. This morning I just woke up and now I'm eating my bread. I am going to eat all my medication which requires some food before I eat them, and I'm feeling a lot better this morning. I cleaned out some of the eyes, I flushed out some of the ointment that was kind of like blurring my vision. Dash is actually sitting opposite me right now. I don't know, his reaction is damn funny. Like I saw him and he stared at me and he was just like, "You have a mustache." I suppose he's referring to this, yeah, or maybe the mustache and the eyes. Then I asked him, does Mama look pretty or ugly? He usually says pretty, but today he said ugly, so there you go. Thanks a lot, Dash. So right now I'm going to eat this medication which is for anti-swelling, another anti-swelling medication, another anti-swelling medication. No, this is antibiotics, yeah, antibiotics. Another anti-swelling medication, terramycin. This is supposed to keep all the stitches lubricated so that it won't turn like brittle and break or something lah. I have a syringe here and it's supposed to irrigate my nose so that all the dry mucus and whatnot that you get after you sleep will be flushed out. And I have eye drops here, just normal lubricant eye drops. This one, another eye drop, and then I have this like special eye drop here. It's a really oily eye drop that I'm supposed to use only before I sleep for antihistamines so that I don't have like get sneezy at night or something. I have this and it's supposed to be a topical application for bruising. It comes in this roller form. This one feels a bit cooling on the skin, so it feels really nice. So I'm just applying it to my bruises. This is a sedative. So in case I can't sleep, this is basically just a sleeping pill. And this is painkillers, which I didn't use because I'm not in pain. I swear this is super excessive. Yeah, when I went for other surgeries, it's just like, you know, 3 or 4. So I'll go ahead and eat all my morning medication right now. Hi, good morning guys. So today is day 2 of my recovery. My face is looking a little bit swollen right now because I haven't had all my anti-bruising, anti-swelling medication yet. So I am just gonna show you guys today sort of my cleaning routine. And at night when I sleep, I wear these protective little plastic thingies on my eyes with tape so that I don't accidentally hit my eyes, so I feel very safe when I'm sleeping. In the morning when I wake up, the eyes will kind of be like filled with a lot of gunk, so I would just use like a Q-tip to kind of gently remove them, and I would also kind of irrigate them with water, scoop some on my hand and just kind of wet the area so that I can clean all of the old ointment. So I just kind of like gently clean. It's not painful or anything. I also have with me here irrigation water. I also have this here with me, a very scary looking syringe, but it's not scary because it's very blunt. So I have with me here the water. I would just put it here inside the nose and just flush, irrigate the wounds. So it's very easy to care for. I just have to do this several times a day, or whenever I feel like the nose is getting a little bit crusty or dry inside. It's important to keep everything kind of like moist, I would say. So just take a piece of Q-tip again and just kind of clean the insides. See the wound over here? Just clean away some of the old tyramycin ointment that's on the wound. Alright, so next thing I'm gonna do is to actually clean my face. It's a little bit difficult because I shouldn't wet these bandages, because the bandages would have to last me until I take off my stitches, which is in 5 days time. So I'm just gonna wash my face now and just use some facial foam here, in case you're actually wondering. I'm using this one, the one that looks like a rose. Okay, so using some facial foam to kind of just wash, I guess. It's easier to use something that's easy to come off. Actually, after surgery, right, like the rest of your face will be filled with like a lot of collagen, but it will not last forever. When you heal, it will be gone and all your wrinkles will come back. Okay, so I've washed my face. I feel a lot cleaner now. So the next thing I'm gonna do is to apply my tyramycin ointment onto my wounds. It smells like petrol. It's just oily stuff. I don't know what it's made of. Probably animal fats. I'm literally using my camera lenses to like do this. Just be gentle about it. Okay, so after doing the tyramycin, I'm also supposed to be using my Rolly anti-bruising thingy. So I'm just gonna apply it. You can apply it on your wounds, I have asked. So especially this patch is quite severely bruised, I think. So just put it on my eyelids here. And I've also got 2 eye drops that I'm supposed to put on every 2 hourly, and these are the 2 eye drops. And then after that, I'm supposed to eat some food first and then take some of my anti-swelling medication, anti-bruising medication, and then I can just kind of relax for the day until midday, where I have to eat a bit more medication. Personally speaking, I like that my doctor is in the same country as me, plus he is really very meticulous. I just can't believe that the surgery actually lasts for about 10 hours. When he did the surgery, he did not eat for 10 hours. He did not go to the restroom at all. And some of the nurses have said that the longest the surgery has taken him is 16 hours. How can anyone not go to the toilet for 16 hours? What the hell? I've never met a surgeon like that. I don't know how the hell he does it. Most eye surgeries, for example, just to give you guys an estimate, will last about 1 hour. And those jobs, I had seen a friend go to a Japanese clinic to do a nose job, and it only took about 1 hour for the surgery. Whereas for me, the first surgery took 7 hours. The second surgery actually took 10 hours. Then I had another friend who went to a famous Thai plastic surgery center. The doctor told her that you are the 40-something patient that day, and it was just early afternoon. They really just treat you as another sushi in the conveyor belt. It's just chop, done, next. But the good news is that for this surgeon, of course, that you know, they have a lot of practice. But the bad news is that they will just treat you as any other default client who wants the default same thing. So if you want something that's a little bit different, I don't think they're going to care that much, because they only have 45 minutes to spend on you before they move on to the next sushi. To me, I think if you can afford it, then just go to a more meticulous surgeon. That's my opinion. I am here at Paragon. I have drove the car here myself. Just looking at the surgery scars and everything, I feel like everything is healing really well. You can see most of the iris, and for the right eye, I think it's a little bit more swollen, so I'll ask Dr. Huang what he thinks about this. Okay, so I just came back from Dr. Martin Huang's clinic, and I was talking to you guys just now about how I feel that this eye is a little bit bigger than this eye. I addressed that to him, and then he said, yeah, okay, this eye seems to be a little bit more swollen, but also because I did the ptosis surgery, the eyes are both very sensitive right now, so you have to do eye muscle training to sort of like have the eyes open bigger. What I'll have to do is to kind of use a piece of gauze to hold down this eye, make sure it doesn't open, and do an eye exercise where I force this muscle open as big as I can, which is to just kind of stare like this, hold it there for 10 seconds. Apparently, I'm supposed to do this at least 10 times each time. Let's hope that it works. What do you think about my surgery?
I'm glad it's done.
Do you think I look pretty?
Not right now.
So we're going to a Thanksgiving dinner tomorrow. You're ashamed of me?
You should wear sunglasses.
Do I look freaky now?
Yes.
Wanna kiss me?
I'm afraid it might infect you.
Are you glad that I'm keeping up to look pretty?
No.
Why not?
I think it's a bit silly.
Why?
Because you're so pretty already, you don't need to do all this.
But I need to. Good morning. This is third day of recovery, Dash has realized that my ear looks very freaky and he's very concerned about it. What happened to Mama's ear?
Injured.
Injured? Is it okay or not okay?
Not okay.
What about my eye?
Okay.
Oh, okay, yeah. I guess he just thinks it looks like makeup. My nose okay or not okay?
Okay.
Okay or not okay?
Okay. Not okay.
Not okay? Is it painful?
Yeah.
Can you give me a kiss or not? My ear pain eh. Can? Oh, gentle, okay. Ayo, thank you. I have been doing a lot of that eye exercise and I feel that it's working. Like both eyes are a lot more symmetrical in size right now. Wound wise, I think you can tell that there is a little bit more bruises, as in like it's a bit more red. The only thing that's actually kind of like bothering me is my zombie ear, cause it's still very black. I do not want to lose my ear. My ear is very cute and very small. I like my ear, but you know I can still feel it, so okay, I think I'm safe there. But other than that, nothing much. I've just been kind of chillaxing at home, playing with Dash. He's not freaked out by me. All he says is that Mama has a moustache, and he was pretty concerned about the ear. But he doesn't think my eyes are injured, which is like, what? I don't understand, Dash. Why are you concerned about my ear? Why?
It looks dead.
Will you still love me if I have no ear? Hello? Why? Hey guys! I put on some makeup and I'm going out for dinner with my friends. I took off my nose bandages because they have been kind of falling off. I think Dr. Huang will be quite displeased with me because I don't think I'm supposed to remove it yet. I'm very pleased with how the nose looks like. Definitely the tip is a little bit more pointy now and a lot more definition. I even put a little bit of eyeshadow beside the nose to shade it so that it doesn't look like it's so freaking swollen. With my sunglasses on, I still look like a reasonably chill girl. Okay, so I'm going out for dinner and yeah, I'll see you guys later. I'm gonna have dinner and scaring my friends. Hi, 谁吗跟我出门 Just now somebody came and wanted to take a picture with me, I think, but I was applying my eye drops. Then she saw me and she xiang away. Good morning guys, so this is day 4 of my recovery and I think the swell has kind of gone down a little bit. Hi Dash! Mama's ear still injured or not injured anymore?
Not injured anymore.
Is Mama's eyes pain or not?
No.
No Look, don't touch! Oh my god, scare me, yeah. So yeah, yesterday night I went out with my friends, went to have some seafood. So today I'm still feeling okay. So I guess nothing happened, nothing bad happened. Okay. Alright, I'll continue the vlogging tomorrow. Bye bye. Say bye bye to the camera.
Bye bye to the camera.
Where? Say again. Never wave.
Bye bye to the camera.
You damn funny. Hey guys, it's day 5 after surgery and I'm back at Dr. Huang's clinic for another checkup. I think my wounds are a little bit itchy now. I think maybe because they're healing or maybe because I ate a lot of seafood, which I probably shouldn't have. Yeah, so you can see that a little bit more bruising here and there. It's turned yellow, which is good. And my zombie ear is looking less zombie-ish. It came out already! So Lynn just took out my ear gauze and it feels so weird to suddenly be able to hear stuff. And she's cleaning up the wound so you guys can have a look. It looks good. It's just little black stitches and a little bit of iodine, so it's yellow, it's not pus. No longer a zombie. I'm so happy. So happy to see you here. I probably shouldn't be doing this, but here I am at the beach. Brought Dash out. Are you excited to be at the beach? Yes. You want to go run into the sea?
No.
No? Why not?
Because
Because?
too deep.
Oh, because it's too deep. Hey, don't dig your nose. What's that?
Sun.
The sun? Why? Is it bright or is it not bright? You see you're foaming at the mouth. Okay, so you guys won't believe it, I am out and walking today. I'm actually filming with Naomi today, so I'm waiting for her to come and pick me up to the location. I think the video is supposed to be about New Year resolutions, and my resolution was supposed to be to love myself and not cut up my face anymore, but clearly the expectations have fallen short, so there I am. Yeah, I actually put on some makeup today. I don't think it's probably a very good idea, but I put everything with ointment first to kind of like protect the wounds, and I made sure none of the makeup touched the wounds, so I think that should be okay. No eyeshadow or anything, that's just natural bruising, man. I must say though, I really love the nose. It's so nice. Oh my god, I'm such a fan. I'm such a fan of my own nose. Hi,
So
we're shooting
我们 Q 过去
with a lot of influencers here.
转回去 then Audrey just like 给笑
Once I start talking. Once I start talking. So right, you move there already.
Director.
You can interact with Noah.
with Noah.
Yeah.
So today is day 7. I forgot to bring my vlogging camera, so I am using the Google Pixel XL2. Today I put a lot of Taramycin aka ointment on my wounds so that it will be very lubricated and easy to remove. Yeah, so I'm gonna be removing these, the entire top lid, and the ear stitches. Is it gonna be painful or not?
You will feel a bit of discomfort, not so much of sharp pain. Good, we're done.
No pain. That was easy. Okay, so we're moving on to removing the eyes stitches now. These eyelid stitches are made of silk. Is it easier to remove the silk?
Yeah,
Oh,
it is.
okay.
First one out. Was that okay?
Okay, no feeling.
So far so good. You okay?
Yeah, so far so good. Okay, we have removed the stitches on one side of the eye and it was not traumatic or painful, so that was great. Yeah, but it is very kind of swollen. Okay, so we're going on to the other eye now.